Good morning, good afternoon. My name is Ellen Lord, and I'm the webinar coordinator for OR Manager. Welcome to our webinar today. We are very appreciative that you're attending. We are going to take a few minutes just to allow all of our participants to sign on. And as we do that, we just want to share with you some advices in terms of any technical issues that may arise. If you can't hear the webcast or the slides are not advancing, please refresh your media player and check the media button and choose either Windows or Flash. Check your speaker volume and the system audio levels. You may need to turn up your volume. If you do have problems, please use the TalkPoint website, www.talkpoint.com/test, to identify or correct any results that come up in red. And just as a note to all of you, the webinars are recorded and made available to participants after the live presentation. Additionally, we just want to share with all of you that with our large audience today, your questions can be typed in at the box at the bottom of the screen in active questions. They all will be answered via email following the presentation. At this time, by way of introduction, we are going to be talking about using automation for tissue management in the OR. Our speaker is Ruth Damon, MBA, RN, who joined Cardinal Health in 2012 and is currently with the Strategic Solutions team. Ruth, I'd like to turn the program over to you.
Thank you very much, Ellen. Again, my name is Ruth Damron, and I'm with the Strategic Solutions team at Cardinal Health. And in the next few minutes, I'm going to share with you a new way to solve the challenges of managing tissue in the OR. And I know how frustrating these challenges can be for you because I've been there too. I've had the opportunity to work in a lot of OR environments and in a lot of different roles. And I feel fortunate that I've had the opportunity to work in value analysis and with contract implementations on the provider side. I came to Cardinal Health almost 4 years ago, and I've expanded my supply chain knowledge on this side. And all of those experiences have helped me to learn a lot about supply chain and operational functions and to understand your challenges even more. So I've seen firsthand how difficult it is to manage not only tissue, but inventory in general in the OR. I also know that there are tremendous opportunities in terms of savings and improving efficiencies, especially with respect to managing tissue. I know what it's like to complete all of those Joint Commission requirements in a manual environment. And not only that, I remember documenting the same thing in more than one place because we didn't trust our system. And unfortunately, I don't think there's been much improvement in the past few years. Just judging by the number of participants on this webinar, I'm thinking that you're still experiencing these same challenges. And if it makes you feel any better, it's not up to you alone to fix the problems associated with managing tissue. There are several stakeholders who need to work together to find a fix. And so with that, we'll begin today with a brief overview of Cardinal Health. And then we'll move on to healthcare trends impacting the OR, barriers to effectively managing tissue. We'll talk about alternative solutions to drive efficiencies, especially related to tissue management. And finally, we'll be talking about achieving support from stakeholders. First, let's spend a few minutes to talk about where Cardinal fits into tissue management. As a clinician myself, I know I'd rather spend my time taking care of patients and not products. But somehow, processes change, and organically, I found myself doing more and more supply chain functions. And as an OR manager, I knew that I could overcome these issues if I collaborated with the right people. And that's where Cardinal Health comes in, with a wealth of knowledge and experience in helping hospitals to create more efficiency in the supply chain so everything can run more effectively. And clinicians have more time to be clinicians. And just as importantly, Cardinal Health has a reputation for understanding the healthcare value chain and healthcare trends that impact healthcare providers. Let's take a look at some of the macro trends impacting the OR and the need to change how most are managing these spaces today. So what's happening in our industry? I know I don't have to tell you that the landscape is changing. All across the continuum of care, providers are concerned about changes in reimbursement as it relates to safety and patient care. And at the same time, you're working frantically to stay ahead of healthcare reform requirements while feeling the pressures to improve your financial performance by reducing the cost of care. A lot of this pressure is now falling on supply chain shoulders, because the OR accounts for the highest supply costs in the hospital, there's a bright light shining on you to improve safety and the quality of patient care as well as to reduce costs. And on top of this pressure to reduce costs, the transition from the fee-for-service reimbursement system to one based on value could be considered one of the greatest challenges healthcare systems are facing. Healthcare providers are not only shifting to shared value, they're shifting to shared risk. As a result, those health systems that can't achieve the required scores will face financial penalties and lower reimbursements. And that's why health systems are looking for improvements everywhere. They're looking for clinical improvements, financial and operational improvements. And in order to help hospitals achieve these clinical, financial, and operational improvements, stakeholders must be fully aligned to help advance the safety and quality of patient care, to stay ahead of healthcare reform, and to improve financial performance. And I want to take just a minute to talk more about financial performance. As I mentioned, one of the most critical shifts is the evolution from pay for volume or fee for service to the value-based payments. If you take a look at the gray sections on the graph, you'll see that the percentage of fee-for-service payments is decreasing by 15% over the next 2 years. And at the same time, alternate payment models that are depicted in red are increasing by 20% to a full 50% of payments that hospitals will receive. And what do I mean by alternate payment models? Alternate payment models refer to the bundled payments, such as shared savings and accountable care organizations. And why is this shift happening so fast? It goes back to the Affordable Care Act. And the Affordable Care Act gives the Department of Health and Human Services the authority to expand payment and delivery models without necessarily needing congressional approval. So that's why it's moving so quickly. The only caveat is that these models must reduce the growth of healthcare spending without lowering quality. So in other words, these models must improve care without increasing spending. And so far, there isn't really a clear trend for which value-based model works best. So the model used varies from health system to health system. But regardless, the shift to value-based payments is accelerating. And this acceleration is requiring the consolidation of healthcare providers in an effort to create a more seamless and efficient continuum of care. What does the shift to value-based payments mean to the OR and for tissue management? Going back to the transition across the continuum of care that I mentioned earlier, it means that there's an urgent need to improve tissue management practices so the procedures in place ensure the safety and quality of patient care. And with that shift from pay for volume to pay for value, there's new and increasing pressure to reduce spending while improving quality of outcomes. There's also the new reality of financial risk and cost associated from payers to providers, as I mentioned earlier with the bundling. And providers are under more pressure to demonstrate differentiated outcomes and improve care coordination, as well as improving patient care itself. So there's a lot going on here. And all of this presents its own set of challenges. And why is this especially challenging for the OR? Well, let's take a look at some of the key barriers you're already dealing with. Here are the top 10 major barriers that prevent the OR from more effectively managing inventory and add to this complexity of managing tissue, which we'll get into shortly. So think about these struggles like heart disease risk factors. Some of the struggles are avoidable, and some of these struggles are just part of our DNA. And no matter what we do, we have to own these struggles while doing everything we possibly can to overcome the struggles that we can influence. One avoidable problem is related to unnecessary costs, and that includes issues with accurate charge capture. We continue to struggle with charge capture because we still have nurses using hard copy charge sheets. to force them to handwrite all of the details for every implant that's used in a case. And even if you're documenting charges in an electronic health record, if that particular product isn't in your system, the nurse still has to type all the information. So I just talked to a nurse who does charge reconciliation, and he told me that 30% of all of the Epic log manipulations that he does is preventable. He's dealing with missing lot numbers and transpose numbers. He's dealing with missing reference numbers and undocumented supply charges. He spends a lot of time investigating and correcting these errors before the charges can be sent to billing. And that's just what he finds. It's a very expensive workaround that many hospitals have had to put in place because of broken systems. The hospitals that don't have a set of clinical eyes reconciling charges are overlooking even more charges. A coder can find the blatant misses, but the subtle misses will go unchecked, and that's lost revenue. Another challenge is associated with the high cost and variation of physician preference items, and that prevents a hospital from negotiating aggressive pricing. One avoidable struggle is the diversity of procedures and service lines that bring multiple supply categories. So when you're doing hearts and neuro and ortho, you're dealing with supplies that require storage in several different locations, like cryo, in freezers, in refrigerators, not to mention just the ambient temperature on your shelves. And then you have to keep a critical amount of some supplies that you rarely use, but you still have to have it on hand. And when you're managing multiple supply categories in several locations, you've got other struggles, such as managing expiring products and obsolescence associated with slow or no-move items. And then, of course, we have everyone's favorite challenge, keeping up with preference cards. So during an assessment a couple months ago, I was in the OR, and I was talking with the supervisor in the case cart pick area, and we were talking about preference cards, and she told me that they have a 63% return rate, and unfortunately, I don't think that's very unusual. So not only are we picking extra supplies, we're keeping them in duplicate locations. We have supplies in the case cart pick area. We have the same supplies in the core, and just in case, we have the same supplies in the room. And we're trying to make good business decisions with limited data. Because we don't have the right data, the actual usage of supplies, guess what? We're tending to employ what I call the emotional stocking strategy instead of using data and facts to make decisions. And along with limited data, we're using multiple inventory systems within a hospital. And on top of those systems, you've got manual systems as well. You still have people running around with a pencil and paper to place orders, or using vast Excel spreadsheets to track inventory. And then you're also using different systems in different departments, and then different systems across hospitals in an IDN. And finally, OR struggle with managing consignment inventory. We're starting to hear feedback from providers and from manufacturers around the value of consignment. Many folks are starting to ask if there's a better way, if there's a different way to go about managing inventory than consignment. In the past, consignment happened because it was the path of least resistance. Clinicians shouldn't be bothered with managing inventory, so it just seemed easier to relinquish that control to the reps and hope that they manage the inventory to our consignment agreements, if we even have visibility to the consignment agreements, which isn't uncommon either. And we're hearing that customers want to modify or reduce or even eliminate consignment in the clinical areas. So on top of all of these struggles, the OR has to contend with the added complexities inherent to managing tissue. Let's take a look at some of those unavoidable risk factors. I know it's a struggle because I've been there. As a circulator, managing tissue was one of my biggest pain points because it took so much time to do all the additional steps and all the additional duplicative documentation. Here's just a few challenges that you're most likely dealing with. Compliancy, pressure from the Joint Commission and the FDA. The regulatory bodies are starting to clamp down on these requirements, and hospitals are reacting. The Joint Commission is looking at procedure management. Does the hospital have a comprehensive tissue management standard operating procedure? And not only that, are these standard operating procedures enforced and trained properly during orientation? They're looking at bidirectional tracing and chain of command, meaning the hospital must show complete documentation every time the tissue moves. When it's received, documenting the package integrity, the temperature, whether and when it's issued out of an inventory location, again, documenting that the temperature, the package inventory. And you can't just take it and go like other products. And if you return it, you have to return it back into the system too. You can't just put it back in the freezer. You have to control tissue at each step, so redocumenting that same information when returning tissue into storage. And then, of course, when it's used, documenting all those same parameters again. Joint Commission is also looking at how effective hospitals are at preparing for adverse events, such as recalls. So in other words, how quickly can you get your hands on information specific to recalled tissue? How quickly can you find out which patient received that tissue, the date, what the lot number was, etc.? In addition to the regulatory requirements, you still have the same challenges with maintaining the right amount of inventory while monitoring for expirations and recalls. So how do we address these complexities to improve efficiencies in the management of tissue? And who's responsible for doing this? To get to the answer, we should first look at the priorities of each stakeholder responsible for inventory management. So if you look at the Venn diagram, you'll see stakeholders, materials management, OR managers, and clinicians. And everybody has their own set of priorities. So for example, materials is really focused on chain of custody and optimized PAR levels. And clinicians' main priorities, as well they should be, are patient care and the clinical documentation. But there's some overlap, as you see on the diagram. And so you can see that everyone's goals are actually more aligned than you might think. A good example is that clinicians also need to care about product visibility to make sure that you have the right item available when it's needed. Clinicians are also responsible for inspecting the integrity of the tissue and documenting that before implanting. So while it looks like everyone is generally on the same page, there's still confusion about who's responsible for what. And there may be a lack of trust as well. For example, nurses might feel the need to manage PAR levels and take responsibility for ordering if they're nervous about running out of stock. And so what can we do to address the challenge? For instance, I think we would all agree that we want clinicians to focus on what matters most, which is caring for patients. So why is it okay that nurses have taken on so much inventory management responsibility? There's got to be a better way to meet the priorities of each stakeholder group without putting additional burdens on another stakeholder. We can start by clearly defining and understanding roles and responsibilities, improving communication among the multidisciplinary teams, gaining stakeholder buy-in to make needed changes, and most importantly, ensuring that every stakeholder trusts the changes so that clinicians don't have to create workarounds. So what is a better way to address all stakeholder priorities and gain buy-in? I say automation, because this naturally establishes clear roles and responsibilities for every stakeholder. So why automation and not manual processes? Let's look at some of the key differences. There can be numerous steps in a manual process for managing tissue. So if you look at the left side of the screen, all of those boxes represent each step required when dealing with tissue. These steps include pulling the tissue from storage, whether it's in the refrigerator, freezer, cryo, issuing it out, and then actually charging for the tissue, documenting it in the clinical record, and completing the implant log, and then finally reconciling to check for errors. And if you pulled the tissue and later return it, there's additional steps that you have to complete to return it to storage. So let's think about it from a manual perspective. There's typically a significant paper trail, and in some cases, duplicate documentation taking place. And how do you know if the data is even correct? And there's typically difficulties in cycle counting. Think about opening that cryo freezer and taking a lot of time to cycle count everything and to check for expiration. And there's, of course, the opportunity for human error and potential compromise to the tissue when the freezer door is open for long periods of time. And not having real-time data that tells you exactly what inventory you have on hand puts you at risk for stocking out or having expired tissue on your hands. And if you don't have visibility to expired and recalled products, you're adding another layer of stress for supply chain to find these products and for the clinicians to make sure they're not getting used on a patient. Manual processes traditionally add numerous steps to the workflow, and that takes a lot of time that's taken away from patient care. So imagine the frustrations your teams must feel. So now let's compare that with an automated system. The right side of the slide shows a number of steps in an automated environment. Multiple steps now are we're down to a couple steps. In an automated environment, supply chain registers the tissue at receipt with an RFID tag and stores it in inventory. Here, at this point, key things are captured, including the lot number, the serial number, and the expiration date. All of that information is captured automatically, and it all transfers over to the implant card. And the person who is receiving the tissue will complete any additional required documentation, such as the temperature and package integrity. And those fields must be required so that there's no chance that these steps are overlooked. With an automated system, you have that assurance. And now all of that tissue information is automatically uploaded in the system, so you now have full visibility. When stored in inventory, you are automatically notified if that tissue expires or if it's recalled, and you know exactly where to go to get it out of inventory. And when it comes time to use it, the circulator just pulls that needed tissue out of inventory and waves that RFID tag product at an RFID reader on the point of view station in the room. And again, all of that required information happens, all of that required documentation happens automatically without any keystrokes or any manual entry. The lot number, the serial number, the expiration date, all of that information flows into your clinical documentation system. It flows to the billing system, and it flows into your ordering system to replenish inventory. And there's no possibility to omit any required documentation like temperature or package integrity or to transpose numbers. And if reconstitution is required, that window will open, so that required documentation is not overlooked. So how much time does the nurse spend using all this sophisticated technology? Not minutes per product, like in the manual environment, but seconds. And typically we find that it takes around 5 seconds or less per item. So let's take another step further and look at best practices that you should consider when selecting a tissue management solution. Best practices for tissue management begins with using RFID technology. And I want to take just a minute and make sure we're all on the same page with RFID because there's different types. The RFID that I'm talking about is passive RFID. It's not the same type that manages the equipment that you have traveling around your hospital. That uses active RFID, and it works completely different. With passive RFID, an RFID tag is applied to the tissue packaging. And when that happens, the identifying information of that product, the product description, the size, the manufacturer or tissue bank, the lot number, serial, expiration, all of that information is now tracked using RFID technology. Now when you put that product in inventory, you use RFID technology to track it. You get real-time visibility to what you have on your shelves. And if the product expires, you get a notification that the product is expired, and it also tells you where to find it. When it's time to use the product during a case, you just wave it in front of the RFID reader in the room. This RFID system feeds your existing systems like Epic or PeopleSoft or Lawson, so two things happen. That exact product is now being matched to the patient. All of the product information automatically flows to those systems with no typing or manual work. And secondly, it's decremented in the inventory management system. And then also, RFID should not be confused with barcoding. And there's actually a lot of differences between the two that I'd like to go through. So RFID offers real-time visibility. It's accurate and it's easy to use. With RFID, you can read as many as 100 tagged products in just seconds. And you capture that data in real time with over a 99% accuracy rate. And a direct line of sight is not required. With barcoding, you have to have direct line of sight to manually barcode scan each barcode on that product. And more often than not, products now have more than one barcode on the package, and so you have to barcode scan every barcode. And then RFID also supports UDI, which is the Unique Device Identifier. UDI is getting a lot of attention now, and it's a system to identify medical devices through their distribution and through their use. So the device labelers, the barcodes on the product, are required now for all medical devices to include a UDI on the device labels or packages. And that UDI is embedded in the barcode information. So part of that barcode includes product identifiers that are consistent, the product name, the description, the size. And then there's also information that changes because that part of the barcode includes the lot number, the serial, the expiration. And so when you're using a barcode scanner, the barcode scanners are not able to parse out that information and differentiate the product identifiers from that specific lot number and serial number. With RFID is able to parse out that information. And so in addition to supporting UDI, there's other advantages to using RFID. First, RFID helps eliminate the possibility of implanting an expired product. Also, RFID quickly locates recalled tissue. And then there's easy access for clinicians, and it's intuitive. You just take the tissue and go. And finally, because the product's location is tracked automatically, you always know where it is. So if another department borrows it, you know it. And if it's not on the shelf and it hasn't been charged to a patient, it will show up as missing in your system, and you can find it. Another best practice for tissue management has to include the ability to ensure accurate charge and usage capture at the point of use. And notice I said point of use and not point of dispense. You have to know when the tissue was actually used, not just that it was removed from storage. And so you need accurate charge capture, which replaces many manual processes with one automated step that takes seconds to complete. There's no hard copy logs to keep, so you've eliminated the possibility for errors related to missing or inaccurate information. A best practice for tissue management requires that it interfaces with your hospital systems to improve your data connectivity. The interfaces also eliminate the possibility for double entry, so everything flows automatically with no hard copies. And also with tissue management, you want to eliminate cycle counting. You want an automated system that eliminates manual counting and the associated errors, and it also significantly reduces time spent managing that inventory. And finally, with the tissue management systems, you have to have strong analytics that provides accurate real-time data. You need those analytics to look at your actual utilization patterns. And with real-time data, you can collaborate with your supply chain team to set inventory levels based on actual usage and not just historical ordering patterns. But how do you build your case for automation? As I mentioned earlier, achieving key stakeholder buy-in is critical, and here's what we suggest. So on the surface, it might seem next to impossible to transform your OR so dramatically. Inventory management issues can seem very large, and the shift to automation just too overwhelming. But it is possible. And so here's where you should begin. First, it's important to be methodical in your approach. So because you're participating in this webinar today, you've already determined that tissue management is an area that needs to be improved. The next step is to create a shared vision with all stakeholders. And this is where a lot of change management fails if all key stakeholders aren't involved in the process. So to do this, all stakeholders need to be involved in envisioning a future without tissue management problems. So that's the definition of defining your vision. What does our future look like without any problems? You're creating your ideal future state. After you've developed your vision, start looking at options. What are all the ways you can achieve this vision? How can you get to your ideal future state? Look at what's worked in other hospitals, or even look at other industries. So I encourage you to do your research, talk to vendors who offer tissue management solutions, and also a big but sometimes overlooked part of exploring options is looking at the future. Make sure that the options you are considering can grow with you. So in other words, do you want to have the flexibility to expand into other parts of your OR, like all of your implants, or even all of the supplies in your hospital? Do you want to have a solution that can grow with you to expand across your entire hospital system so you can have shared inventory across your entire system? And when looking at options, look at the vendor. Is this a mature vendor who has the ability to provide the level of implementation and ongoing support that you require? So now you're at the point where you want to start to develop a list of requirements that a solution must provide. So from a clinical perspective, a requirement might mean that the solution must eliminate all manual documentation and that it has to provide triggers to make sure that all the required documentation is completed. From a supply chain perspective, a required attribute might be that the solution provides visibility to the chain of custody and that its inventory management functions are automated to eliminate cycle counting and manual expiration management. From a finance perspective, the ideal future state will probably include the ability to control costs by optimizing power levels and ensuring that all charges are captured. So notice how all of these system requirements are aligned with the trends that we discussed earlier. And then after developing your solution requirements, you're now at the point where you've committed to a solution and you're implementing. After implementation, you still have to have ongoing evaluation using data to make sure that the solution is doing what you expect it to do. It should be improving patient safety. You should be eliminating manual processes, improving charge capture. You should be decreasing costs and improving your workflows. So what could an ideal workflow look like for tissue management? So as we've discussed, accurate and complete tissue tracking is critical to patient safety, and hospitals have to follow strict tissue tracking standards to maintain Joint Commission accreditation. No surprise. At a high level, there's a workflow. Here's a workflow here that incorporates the best practices that I mentioned earlier. It's a 4-step process that starts, number 1, adding that RFID tag to the tissue when it's received. The next step is the tissue is placed in inventory until it's needed. The clinician then pulls the tissue, scans that RFID tag at the point of use, and all of that key data, the product information and preparation notes, expiration, the package integrity, the temperature, the charge capture, all of that information, it automatically flows to the clinical record and automatically completes the tissue implant card, so it's ready to submit to the manufacturer and to the implant registry. This Cardinal Health module is intuitive, and it's a very practical way to manage the chain of custody for tissue. And it enables the smooth transfer of data for simplified compliance, and it also streamlines your workflows. So let's take a look at how that data gets into the clinical record and the implant log. So as you see here, the information contained has information such as the patient name, the implant location, and any inspection notes. And that's no different than what you're doing today, except you're most likely doing it manually. And with our system, the fields are required, so you can be certain that all the required documentation is completed. And furthermore, those fields are they're really intuitive. And so if you have travelers, this is really important. And our solution digitizes this information and creates an automated implant log, significantly reducing errors and the time spent on manual entry and reconciliation. But what if a product is pending expiration or if it's recalled? What does that look like? This is an example of our dashboard of information gathered from the data collection tools. So when you receive a product at your hospital and attach that RFID tag, all of that information that's gathered at that time, the lot, the serial, the expiration, all of that information is automatically stored in the system, and that's how you see it here. All of the information you see here required no manual inputs. And so as I mentioned earlier, the RFID automatically tracks the expired and recalled tissue. And here's where you see that in the clinical alerts on the left side of the screen. This is set up so it's all management by exception. All of the items in red are the issues that should have your attention. And the dashboard also identifies and alerts users to the potential and actual deviations from the norm. The dashboard tells you which items are expired or about to expire and what products are missing so you can find them. And it shows you consumption rates and patterns, and the exact location of trackable items, along with updates on implant registration cards. So for instance, if you look at the bottom right corner of the screen, if tissue was brought in as trunk stock and it goes directly into the room, some registration steps might get skipped. And the system knows that this is a deviation from the standard work, and it notifies you. And in addition to this safeguard, there's other safeguards built into the system in the event that there are other deviations from standard work. Here's an example of the implant record that the provider completes and submits to the supplier, completing the chain of custody. In this example, the tissue is expired. So if all of the dashboard alerts were overlooked and that expired tissue stays in your inventory, and if the circulator waves that RFID tagged tissue without physically checking the expiration on the package first, this screen pops up. And so there are several safeguards in place to prevent that tissue from ever reaching a patient. And also, in this step, if the tissue required any type of reconstitution, another window pops up. So the circulator knows exactly what must be documented, so what medium was used, what was that lot number, what was that expiration date, the product that they used to reconstitute the tissue. Which takes us to our final slide, how we can help support critical requirements from Joint Commission. Cardinal Health incorporated all of these requirements in the system. So now you can be assured that everyone involved with the management of tissue is set up for success. There's no need to commit any of these requirements to memory, and there's no chance that you'll overlook any required step because the system automatically guides you. And above and beyond any of these regulatory requirements, you're setting your teams up for success because they want to come to work every day to provide quality patient care. And now these processes and workflows will support that. And I know that managing tissue in the OR is complex, but with the use of the right automated system, using RFID technology, you're eliminating a lot of the complexities that are inherent in manual systems. We created the solution to meet the challenges that we know you're facing today. And our solution helps to address many of the requirements of the Joint Commissions that are listed here. The result is more efficiency, clearer documentation with a simpler workflow that allows you to focus on patient care. And again, as I remember when I was working in the OR, how painful it was to do all these manual steps. An automated solution using RFID technology makes it simple to capture all of the data. So I can focus my attention on where it matters the most, which is taking care of the patient. Our solution is also scalable to your needs, so you can implement it at your own pace. The system is designed to start small within a specific area like tissue and then grow from there into other areas like I mentioned earlier, like all of your implants or even suture or all of the supplies in your OR or throughout your entire hospital. So this is the future of automating inventory management that controls costs, it improves patient safety, and it simplifies workflows. And I appreciate your participation in this webinar today, and I'm happy to answer any questions that you might have.
Thank you, Ruth, so much for your informative presentation. We do have time for some questions. I would like to pose the first question, and in that regards, I already have an automated tissue tracking system established in my OR. How easy is it to switch over to a new system?
Yeah, that's a good question. And so if you have a system in place and you're looking at other alternatives, that means that there's still gaps and they're still experiencing problems with tissue management. So go back to the steps that we talked about earlier with the steps involved in getting to that right solution. So first, it's developing that vision. What does your future look like without any tissue management problems? What is your current system not doing? So that's going to lead you to creating your system requirements. And then after you do system requirements, then you can start to look at who's out there who can meet those requirements, and then go from there through the implementation. And because you already have an automated system in place, it's easy to transition to a different automated system without any gaps in patient care or any problems with the automated documentation. So you can make sure that your implant logs remain intact, and that you have your SOPs in place that would require that Joint Commission that would satisfy that Joint Commission requirement.
Thank you, Ruth. I am currently using barcoding technology to manage my inventory. How does this technology compare to your approach to inventory management?
Yeah, there's a lot of people think that barcoding and RFID is very similar. So I'm glad you asked that. Glad that question came up. So with barcoding, you actually have to have a direct line of sight to that barcode on the package. And in most cases, 2 or 3 barcodes on a package, because you never know what barcode is the right barcode. And so having that direct line of sight and having someone physically barcode scan those products every day to have visibility to what you have on hand versus RFID, which does not require that direct line of sight, because the RFID technology reads those tags up to 100 tags a second with a very high accuracy rate, over 99%. And then again, going back to that UDI, which is getting everyone's attention now, because clinicians are ultimately, at this point, oftentimes are responsible for inputting that information, the lot number, the serial number, and the expiration date, because barcoding doesn't have the ability to parse out that information on the barcode. So having RFID technology allows you to have that information flow automatically without any manual inputs.
Ruth, you talked about the Joint Commission requirements. How does your system know that some tissue requires reconstitution and what needs the temperature checked?
Yeah, that's a really good question, because it's interesting because there's some differences in the FDA and the Joint Commission and the different requirements, and so that leads to a lot of confusion. And so for the most part, the Joint Commission and the FDA have similar criteria because they both define tissue as the products that are cellular in nature. But the Joint Commission differs somewhat in that they also include xenografts, and so any product that contains animal tissue is considered tissue, and the FDA excludes that category. And then another difference is between the FDA and the Joint Commission is sometimes the Joint Commission will classify something as tissue, and the FDA will classify it as a medical device. Like if you look at DBM, demineralized bone matrix, the FDA classifies that as a medical device. And so the system using our system with RFID, when you set up your catalog upon implementation, you flag all of the tissue, and if it requires reconstitution. So anytime you receive that product into your hospital, the system recognizes it and recognizes what the documentation requirements are, so you don't have to remember. Things like this shouldn't have to be committed to memory. Circulators shouldn't have to think, is this tissue, is it not tissue? Do I have to document reconstitution? And I have to remember that in addition to all of the patient care details that they should be focused on. So having the system automatically flag all of that required information allows for the workflow to pop up automatically, so circulators can be compliant without committing anything to memory.
Thanks, Ruth. I've heard of RFID tags not working in colder environments where they may fall off, especially in the cryo or freezer. If this is the case, how do you address this?
Yeah, I'm glad someone asked that question too. That's a really good question, and our developers address this during the development process. So they put RFID tag products in cryo for long periods of time and tested it. and they found that the RFID tags function perfectly well regardless of temperature. So the information that it stores, the lot number, the serial, the expiration, all of that remains intact, and the RFID technology works very well in that environment. Some of our customers feel more comfortable by double bagging the tissue. So when they receive the tissue, they will apply an outer bag with the RFID tag inside that outer bag. So just for their own peace of mind, in case that RFID tag were to come off in that tissue from the tissue packaging, it still remains associated with that tissue because of that double bagging, and they're really happy with that process.
Great, Ruth. Another question, how do you work with existing equipment? For example, the refrigerator. And do we have to replace all of our equipment?
Oh, I'm glad you brought that up. I wish I would have mentioned that in the actual presentation, because a lot of people might be assuming that oh my gosh, we invested a lot of money in all this capital equipment, and now you're asking me to invest in all this RFID technology. And that's not the case at all, because we understand that your current hardware, the cryo, your freezers are all hardwired with your temperature logs, and we certainly don't want to interfere with that. And so we recommend that you keep your current hardware, keep all of your current equipment, and using an RFID smart wand, you simply wand over those products and it captures all that information on the RFID tags, again, without requiring that direct line of vision and reading up to 100 tags a second, so you're in and out quickly.
Great, Ruth. Thank you. How does your system link with OR information systems and other interfaces?
Really, another good question. So our system, we have interfaces already established for all of those systems. So waving that RFID tag product one time at a point-of-view station allows that information to interface directly with your clinical records, with your billing records, and your ERP or your materials management system.
Thank you, Ruth. We do have time for, I think, another question or two. With your current customers, what were their pain points that led them to consider an automated system?
Yeah, I'm glad that question came up too. That's really very timely, because it's very consistent regardless of what customer we're talking to, what part of the country we're talking to them in. It's always, we are concerned about being compliant with the Joint Commission. We don't have standard operating procedures, or we do have standard operating procedures, but we're not sure that they're being followed consistently. Another common pain point is that traceability aspect. So being able to get your hands on any recalled tissue after it's been implanted. Hospitals are going through tomes of hard copy logs that they're keeping in off-site storage, and they're going through those in advance of a Joint Commission audit so they can practice getting their hands on that information. In an automated system, they understand and appreciate the fact that you can automatically trace that exact lot number in a matter of seconds. And then another common pain point that we're hearing is charge capture. ORs are missing a lot of charges because of these inefficient, cumbersome manual processes, or they're spending a lot of time and money dedicating a lot of resources to the reconciliation process that delays billing and oftentimes prevents them from billing patients. So the Joint Commission piece of their SOPs, the traceability, and then that charge capture are what we're hearing across the board.
Great, Ruth. Some of the steps that we might take for our clinicians, what are they to better understand the business side of tissue tracking and how the use of an automated system can help them?
I want to make sure I understand. So how can we help our clinicians understand the business side?
Yes, Ruth.
Yeah, so, that's, coming from a manual system, again, I remember opening supplies and not having any idea how much they cost. And so I know that that's not the major determining factor, but when all end users, circulators and surgeons alike, when they can see the cost of supplies and they can understand the variation as well, and understanding how important it is to select the right product for the right patient, so appropriate utilization, people really respond to that if they have data. And so having an automated system that shows you, what are our best demonstrated practices? What's the difference in cost? People don't even people don't know the difference in cost between like antibiotic bone cement versus plain bone cement. And so looking at those types of costs and looking at the right type of procedure, the right type of patient to use those products, having an automated system gives you that visibility that you've never had before to make really good, sound business decisions.
Thank you, Ruth. And I think the last question I have to ask is, can your solution only be used with Cardinal Health products?
No, even though the Strategic Solutions team is a business unit within Cardinal Health, we are completely vendor agnostic, product agnostic, and so this system, RFID technology, works well with all products, all manufacturers, all vendors, because we're looking at the products themselves and how they're used within your organization and not looking at a vendor-specific product. So, no, clearly not specific to Cardinal Health products.
Well, thank you, Ruth. We are coming to the end of our webinar presentation for today. Just a reminder to our participants who have submitted questions, they will be answered via email from Cardinal Health in the current future. And by way of thanking Cardinal Health, we appreciate your support of nursing education and OR managers. We know through your company, education advances and the profession increases in their knowledge. Thank you again, Ruth, for your insightful presentation. And to our participants, we would like to remind you that if you log on, you can get your continuing education credits for this particular session. And if there are any additional attendees, they can log on as well. Just as a reminder, the on-demand version of the webinar will be available 48 hours after the live presentation of the webinar. And in addition, we would like to say again to Ruth Damon and Cardinal Health Care that we appreciate your support of our efforts, and we hope that all the participants enjoyed this webinar today. Have a good day to our listening audience, and this will conclude our webinar for today. Thank you.
Hey, Ellen, get back to your students.
Okay, did you hit the end button for me? I lost my server and it wouldn't type into you.
Okay, I ended it.